you say your last name?
Rysdyk.
Rysdyk. Matthew Rysdyk. The eyes are the windows to ... concussion testing. And Matthew, you can start whenever you're ready.
Most people have heard the phrase that the eyes are the windows to the soul. And while that may be true, I'm here to discuss with you that the eyes may be the windows to concussion testing. Concussions can cause a host of physiological issues ranging from photophobia, memory loss, and even emotional trauma due to the event. Concussions can leave individuals with chronic issues, and some concussions, if mismanaged, can be lethal. In collegiate athletics, a common tool used in the diagnosis and management of concussions is the Standardized Assessment of Concussion, or the SAC form. To date, there are no known studies that compare this form to an objective-based measure that tests for the prevalence of concussions. A potential objective way to test for the presence of physiological changes that occur with concussions is through visual observation of the eyes via the pupillary light reflex. The pupillary light reflex is just as it sounds. It's how the pupil reacts to a flash of light, and is normally done with a pen light and visual observation, which carries high subjectivity. An area of interest in the research that I helped to conduct this past fall was the use of a pupillometer device in an athletic population. A pupillometer device is one that senses where the pupil is, provides a flash of light, and objectively documents all factors of the pupillary light reflex, which is crucial because the difference between a normal baseline reflex and an abnormal one due to injury can be so small that even the most trained professionals would have a tough time documenting changes. Current research using a pupillometer device has been limited to small populations of both civilians and soldiers, but what these studies have shown us is that individuals that have concussions can have changes in pupillary constriction and dilation velocities, as well as a slowed reaction to light. What all of this means for us is that concussions can affect automatic body reflexes, like the pupillary light reflex, which we are not well equipped to measure in daily practice objectively. So, this past fall, another classmate and I helped to conduct concussion baseline testing. We collected data from 109 NAU athletes from differing sports on both the SAC and a pupillometer baseline measurement. The goal of the research this past fall was just to document baseline numbers in a larger population than previous research, as the project in the next coming years will be to assess those athletes as their respective sports seasons go on to see how their numbers may change with injury. This could potentially allow us to expand the use of a pupillometer device into an athletic population that puts themselves at risk for concussion each time they step on the playing or practice field. With all of this, our hope is that over time, pupillometers will be integrated with current measures for the on-field assessment and off-field management of concussions, so that the athletes that we love to watch can be completely and objectively healed from previous brain injuries to avoid future life complications. Thank you.